Okay, so let's continue to the contraceptive topic. Yeah. Uh, Here are some brief information about the contraceptive method. That contraceptive is family planning. One is the way to plan about the family growing. So the aim for the contraceptive is to control of the birth. Yeah. For example, sometimes to prevent from the STIs, and then maybe to control the interval, the interval times, for the first baby to the second. I mean, for the first child to the second child, and then of course to control, maybe to some consideration to see the patient condition or the disease. For example, and the patient have some very heart condition, and then it's best to prevent first the pregnancy. So this is the aim to contraceptive is to control the birth. Okay, you as a pharmacist, when after school, you will get some people that want to take some contraceptive, and then you can provide some contraceptive services, but it's best if you consider the 5 steps, to providing the contraceptive services. For the step 1, please establish and maintain the report. So in this step, you can ask to the people. Please ask with open-ended question. Ask about what is, maybe for example, ask about what is the preferred patients to use contraceptive, and then how long the patient want to take the contraceptive services, and then any difficulty or not to take some contraceptive services. For example, if the patient is very hard to remind to if must check the pill every day, maybe you can give some suggestion to take the other method of the contraceptive, or the other types of the contraceptive, and the other please ask about the upon open-ended questions, and then demonstrate expertise, threats, worthiness, and accessibility. Give some depth, consider gives that point to the patients. I will use the pointer first. Okay. And then still in the step 1, please ensure the privacy and confidentiality to the patients, and explain how personal information will be used, because this is a very private condition information to the patient. So explain that how the information will be used, and then encourage the patient to ask the question. If actually if you cannot find that the patient or the people cannot understand enough through your information, and then demonstrate empathy, just listen, and then observe, and then withhold judgment. Okay, that is the step 1. Let's move to the step 2. Obtain clinical and social information. Ask about the medical history, especially about the menstruations. Is it regular to the time or no? And then any late periodic, or any other condition once the menstruation, yeah. And then ask about the pregnancy, breastfeeding, and recent intercourse. And then ask about the chronic disease, for example, hypertension and drug allergies, and ask about the risk factor to the thromboembolic disease. Yeah, this is ask about the medical history, and then ask about the future pregnancy intentions. It's also about the contraceptive experiences and preference, and then ask about the sexual health, sexual practice. Is it like how many times in the, for example, in the month or maybe in the weeks? Is it healthy sex or no? And then current and recent partner, and then using the condom or no, in nowadays, in the present. And then previous sexual transmitted infections, sexual transmitted infection must be asked to the people, and then after that you can choose the best contraceptive, and then you can give some recommendation of that contraceptive to the patients. Okay, the step 3 is about the work interactively. Select most effective medically appropriate method. This is some consideration. Overall method that can be used safely. Actually, all method can be used safely, but it's based on the patient condition. For example, like if we want to give hormonal method or types, you have to make sure that the patient there's no condition that can be more worsening if you use the hormonal types. For example, any hypertension conditions, or many and dizziness conditions, it's best if the patient not use the hormonal, for example, like that. So actually all the method safe, but it's based on the patient condition. Okay. Use a tiered approach. Tiered approach. Discuss most effective method first, and then discuss correct and consistent use. Consider the patient reported ability to adhere, and then identify barrier to success. For example, like social behavior, mental health, substance abuse, and then partner violence factor, and this may guide decisions to choose the medication from the identify the barrier to success, and then discuss adverse effect, and then recommend dual method use, hormonal and barrier method, if the patient wants, because if you use or maybe if the patient use dual method, it's make sure the contraceptive will success. The contraceptive method will success, because if the one method is failed, the other method will help. And then discuss any non-contraceptive benefit, for example, like treating abnormal uterine and bleeding. Okay, after the choose, this select most effective medical appropriate method, and the next step is physical assessment and when warranted. So make sure the blood pressure or count the blood pressure before initiating combined hormonal contraceptive, and then pregnancy testing first, if needed, and history is usually satisfactory, and weight measurement for monitoring changes, and then to avoid logistical, emotional, or financial burdens, omit pelvic examinations. This is some physical assessment before using the contraceptive. And then the last step is provide method, instruction, and follow-up plan, and confirm understanding. Begin method at time of the periods. This is reasonable. If reasonably a certain patient is not pregnant, bridge until a long-acting method can be safely established if necessary, and prescribe 1 full year supply. And for the other instruction is make the condom easily available, and any strategize for anticipations, maybe on porn alarms, and individuals follow up. This is 5 steps for the providing contraceptive services. Okay, this is any type of the contraceptions. In general classification, you can say as the pharmacologic class and then the non-pharmacologic class. For pharmacologic class, any spermicide that directly kill the sperm, and then any hormonal. For hormonal, any 2 types, combination estrogen and progestin, or progestin alone. For the non-pharmacologic, any periodic abstinence is mean control the sexual activity. Actually not to take sexual activity when in fertile phase, or the fertile times or fertile days. And then the other non-pharmacologic types is using the barrier. I will explain in the next slide. As you can see here, the first, this is showing by the showing based on the effectivity. So very less effective is using the fertility awareness based method or the calendar method. As I mentioned before, not use not do some sexual activity in the fertile days. And then spermicide can call as the less effective also, because this is like pasta, and then the pasta have to be put in the vagina, and then it's not make sure all the sperm will kill by the spermicide. Okay, and then move to the next effectivity. This is any 18 or more pregnancy still can happen in 100 women in a year. Any male condom, female condom, and then any some withdrawal, and then spawn. This is some the other method. Okay, condom, spawn, and withdrawal use correctly every you have sex. So this one is have to use when the people want to do some sexual activity. Yeah, so after that you can move out from your the people reproductive system, and then move to the next level. Here any 6 to 12 pregnancies will happen per 100 women in a year. Any injectable, pill, patch, ring, and then diaphragm. So for the injectable must be repeated, must be repeated in some periodical times, and then for pills must take each day, and then for patch and ring keep in a place and then have to change on time, and then for the diaphragm use correctly every time you have sex. So I will give you the other information about the pill. For pill and two types also, from the ingredients I mentioned before, any estrogen and progestin, and then the other one progestin only. But from the amount of the pill, any 21 days or any 21 pills, and then any 28 pills. So for 28 pills, actually I need 7 pills that's just placebo, so there's no hormonal ingredient in that placebo pill. So the 28 pills will help the people or the patients not to forget to take the medication, because if you use the 21 pills, it's any a big opportunity to forget to take again the medications. And then the most effective, less than 1 pregnancy per 100 women, any implant, and then intrauterine device or IUD, and then any male sterilization. If male sterilization and female sterilization is permanent, so we will not get the baby anymore. Okay, here are some considerations if you want to choose the contraceptive. Please ask about and if you want to give some counseling, please ask about the drug, not ask, but consider some drug interaction with hormonal contraceptive, for example rifampicin and lamotrigine, because the antiviral reduce the effectiveness of the contraceptive, for the hormonal, and the lamotrigine monotherapy may increase seizure activity. And then for disease complication, you have to ask also to the patient, and from this information you can consider which one the best contraceptive method that can be used from the patients. For example, any breast cancer, theoretical concern for worse prognosis of disease, because if the patient use the hormonal estrogen and progestin, it will lead to some worse prognosis to the breast cancer. And then for the hypertension, ischemic disease, it's will lead to acute MI and stroke. And then for the lifestyle, and smoking or no, and how old the patients is real risk for cardiovascular disease, including myocard. This is how to use contraceptive hormonal pill. I mentioned before, yeah, that the hormonal pill any 21 day cycle and then 28 day cycle. It's actually for 21 and 28. This is for the combined oral contraceptive, yeah, or COC. And then for progestin only pills or POP, it's best for a breastfeeding woman. Yeah, I will put the video also in your next. I think it's enough for this tutorial. Yeah, please prepare your counseling. Thank you.